good morning and thank you for attending. Today I'm joined by Louise Gagné, Executive Director of Community Services, to give an update on our local COVID-19 situation. Shannon Mantha, Executive Director of Clinical Services and Chief Nursing Officer, who will provide an update on the COVID-19 vaccine rollout. Before we proceed, I would like to take a moment to acknowledge that the Health Unit resides on land covered by the Robson-Huron Treaty of 1850. This land is the traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I'd also like to acknowledge the Métis historical presence in the region. As we celebrate the world of sport over the next 2 weeks, we are reminded of the barriers that many Indigenous people must overcome, including poverty, isolation, health issues, intergenerational trauma from residential schools, and cultural barriers to be able to perform on the world stage. Let's continue to work together to help recognize and remove these barriers as part of the decolonization and reconciliation process. This week, many restrictions were loosened, including increased numbers for social gatherings, increased capacity limits at many locations, and the reopening of indoor dining. We've experienced many bumps in the road since March 2020 as we learned how to navigate the pandemic. As one wave ends, we find ourselves asking, will this ever be over? We might be wondering how we move from pandemic to just learning how to live with this virus. These are valid questions. As immunity starts to increase through vaccinations and infections, the ability for the virus to be able to spread will decrease. As we have seen throughout the pandemic, we can help to slow the spread through vaccinations and behavior changes, such as wearing a mask or face covering, reducing contacts, physical distancing from others, and washing or sanitizing your hands often. We have also experienced the virus changing into one that is less severe, but spreads more easily and quickly, the Omicron variant. On Tuesday, the Ontario Science Table updated their COVID-19 projections. The current indicators suggest this phase of the Omicron wave has plateaued or is in decline. However, provincially, hospitalizations are at a pandemic high for all age groups. ICU occupancy continues to be high. Staffing in hospital remains critical. According to the latest modeling, it is uncertain what these numbers will look like in the next few weeks or months. Deaths may be increasing or are already at their peak. It's difficult to know for certain. The Science Table has reaffirmed that vaccination, including third doses, provides strong protection against serious illness. Increasing vaccine uptake across all groups will reduce the impact of the pandemic. Locally, we are experiencing increases in hospitalizations and ICU admissions. By yesterday afternoon, there were 10 people in hospital due to COVID-19, the highest number we have had since the start of the pandemic. We also know that there were an additional 11 people in hospital with COVID-19, but are not hospitalized due to their COVID-19 infection. Although we only report the number of people in hospital due to COVID-19, we know that when people are in hospital for a different reason, but also have COVID-19, additional staff resources and infection prevention and control measures must be put in place. Having people in hospital with COVID-19 also increases the risk of an outbreak in the unit or worse, facility-wide. So to summarize, the pandemic and our response to it is changing. There is cautious optimism that Omicron is declining and restrictions are slowly being lifted. However, there is concern that with the healthcare system currently under stress, loosening restrictions could worsen the situation. So we still need to move carefully and each of us do what we can to keep the healthcare system from being overwhelmed. By continuing to follow public health measures, being fully vaccinated, having your eligible children fully vaccinated, and receiving your third dose, we can begin to move towards living with COVID-19. And with that, I'll pass it over to Ms. Gagné.
Thank you, Dr. Chirico. Since our last press conference, unfortunately, 2 individuals have passed away due to COVID-19. As Dr. Chirico already mentioned, as of yesterday at 3 p.m., there are 10 individuals from our region in hospital due to COVID-19, the highest number since the start of the pandemic. According to Ontario's Science Advisory Tables dashboard, there are currently 2,000 972 individuals in hospital in Ontario due to COVID-19. This is a decrease of 27% in the past week. With respect to percent positivity, our rate is 13.6%, meaning that about 1 in every 7 individuals who receive a PCR test get a positive result. Now back to you, Dr. Chirico.
Thank you, Ms. Gagne, and I'll now pass it over to Ms. Mantha.
Thanks, Dr. Chirico. So as of yesterday at 3 p.m., 4,365 of our 5 to 11-year-olds have received at least 1 dose of the COVID-19 vaccine. This represents 51% of 5 to 11-year-olds in the Health Unit District, which still remains slightly lower than the provincial rate of 53.8%. It is critical that we have our children vaccinated against COVID-19. As a parent of 2 boys, I understand it is our role to do everything we can to protect our children against harm. Health Canada has one of the most rigorous scientific review systems in the world, and it only approves vaccine if it is safe, if it works, and meets the highest manufacturing and quality standards. And to date, millions of children have received their vaccine with no concerning safety signal identified. Vaccinating your child will provide them with a strong level of protection against COVID-19 and any variants. If you'd like to speak to someone to learn more, you can visit ontario.ca/COVID vaccine kids, or you can also call the Provincial Vaccine Contact Center to speak with an experienced agent or a health specialist. In addition, you can contact the Sick Kids COVID-19 Vaccine Consult Service to book a confidential, judgment-free appointment with a pediatric registered nurse. You can find this service at Sick Kids website at sickkids.ca/vaccine consult, or you can call their 1-800 number at 1-888-304-6558. This service is available in multiple languages using over-the-phone language interpretation. If you are ready to book your child's vaccine appointment, please do so. You can do it online at ontario.ca/book vaccine, or give us a call here at the Health Unit at our call center at 1-844-478-1400. Walk-ins are accepted at all of our vaccine clinics, and you can also still book an appointment if that's most convenient for you. So with that, I'll pass it back to you, Dr. Chirico.
Thanks, Ms. Mantha. So that ends our remarks, and we'd be happy to take questions. You put them in left of the box, and I'll pass it back to Mr. Dermott to give us the first question, please.
Thank you. Our first question is for Dr. Chirico. It comes from Stu from Bay Today. Dr. Chirico, does the public health messaging or strategy change, knowing there is a segment of the population that will never go along?
Well, thank you for that, Stu. And no, I don't believe it does. I would rather focus on the vast majority of people who are doing a great job at following public health measures, getting themselves, their families vaccinated, and it's working. We're just around the corner, I believe, from things significantly improving, but still, you know, there is a bit of a lag. We are seeing hospitalizations, and that it will likely continue over the next couple of weeks, and hopefully beyond that, things will improve significantly and more measures can be lifted. But no, our strategy does not change. We have to move cautiously through this next little while, but we've done extremely well when you consider how long it's been and what we've been through.
Thank you. Our next question is from Rick Coffin at mynorthbaynow.com. What is your reaction to the local, national, and all mandate protests? Is there concern these types of events could further spread the virus and end up prolonging the pandemic and restrictions?
Yes, there's always the risk that when you have increase in contacts and increase in gatherings, yes, there certainly is a potential for that to spread. I think everybody has the right to protest respectfully. From the national stage and what's happening in Ottawa, I think that what's been displayed has been anything but respectful. And I think that when you're using racist symbolism, when there's violence, when there's intimidation at a homeless shelter, I think that that kind of disrespect for our country, it's really disgusting and it's shameful. Locally, you know, we haven't seen that. I'm hopeful that people, and they do have that right to protest and do it respectfully. But I also do think that we have to focus on the vast majority of what people have been doing, and they are showing respect to each other. They're going into stores, they're physically distancing, they're wearing masks. And masking not only helps to protect yourself against COVID-19, it also showcases people's respect and support to help keep businesses open and workers safe. And that's so important. And I think that the vast majority of people, I don't want a few to take the center stage, because we do know that most people have done an amazing job in our communities to follow the measures that we need to follow to keep everybody safe, to keep our healthcare system from being overwhelmed, and from keeping our healthcare workers safe in all the different settings. So when people choose not to follow these measures, they're really putting their own beliefs about the health and safety of staff, and that can result in healthcare system under pressure, businesses having to close and to increase because of staff, you know, shortages and illnesses. So, you know, everybody knows what they need to do, and I think they've been doing a great job. And I don't want it to be overshadowed by a few.
Thank you. Our next question is also for you, Dr. Chirico. It comes from Stu from Bay Today. Do these protests affect the morale of healthcare workers?
Well, that's a very good question. Personally, for me, and I know my staff, I get energized by it, because it makes me really believe in that what we're doing is really positive. And I won't let that kind of behavior that we're seeing intimidate us. We know that what we're doing is working, that we're getting through this pandemic, and everybody's been working very hard, everybody's tired, but I think that the strength that I've seen among our staff and the staff at hospitals, they're amazing people and deserve to be celebrated.
Thank you. Our next question is also for you, Dr. Chirico. It comes from Jennifer Hamilton McCharles from The Nugget. So many countries like Denmark, England, Sweden are lifting all restrictions, and there's criticism of Ontario. Canada is moving too slow and people are becoming increasingly frustrated. What is your opinion on the reopening plan?
Yeah, that's a very good question and point, Jennifer. You're absolutely right. I mean, people are tired, people are frustrated. But we also have to first look at, you can't always compare what's happening in Europe directly to what's happening in Ontario. There are certainly differences. We have to look at immunizations, the societies, that it isn't an equal comparison always. And I think that we have to look at what our system is undergoing right now. And I think the biggest issue right now is, even though cases are going down, there is still pressure on our healthcare system. So we have to really be aware of that, and we have to go with what the science and the evidence is telling us within Ontario. And the science table has really been excellent at providing us with that information. And what they're saying is that when you do loosen restrictions too quickly, that you will see increasing contacts, increasing potential for more cases, more hospitalizations. So I think that the strategy that's in place, although it's not popular, everybody wants things to be back to normal, no restrictions. I get that, but that's not the reality we're facing. And the predictions that the science is saying, and that there may be increasing cases, there may be increasing pressures on our healthcare system. And that affects everybody. And we want to get back to the place where we can ensure that tests that are required for other issues besides COVID and surgeries can get back on track. There's quite a backlog. So we need to move cautiously, because if we go too quickly, we'll be taking 2 steps backwards, and nobody wants that. So I agree with the approach that's being taken, that decisions are being made based on the evidence, and we slowly reopen.
Thank you. Our next question is also for you, Dr. Churko. It comes from Clark from your TV, Cogeco News. Good morning. My question is for Dr. Churko. What is your message to protesters engaged in local freedom rallies, including the one that was planned for outside the health unit this morning? Protesters are calling for an end to all government mandates.
What I would message them is protest respectfully and observe public health measures, which that's going to be up to them to decide. That would be it.
Thank you. Our next question is from Jennifer Hamilton McCharles from The Nugget. Are you concerned, or is the health unit concerned about these demonstrations?
Yeah, in the regard that the increases risk of the people that are there, yes, and that affects certainly if they get sick or they pass it along to other people, their family, their friends, and it shows disregard for others. And yeah, am I concerned? I'm always concerned with everybody's health. And so I'm hoping that, they are respectful. And again, I would rather focus on all the people that are doing what they need to be doing. And we've done a really great job to keep our local numbers low. And we are seeing increasing pressures on our hospitals right now. And we all need to do whatever we can to help that situation get better.
Thank you. Our next question is for Louise. It comes from Sarah Bissonette from the North Star. The province lists absenteeism per percentages for schools online that don't differentiate between a person away for COVID-19 illness or a snow day. The percentages have been quite high, such as 20% at different schools. What conversations have been had with the different school boards, specifically the Near North District School Board, around this rate and the possible need to close schools? What advice do you give to parents looking to these numbers in making decisions for what is safest for their children?
Thanks, Sarah, for that question. You're correct. The numbers displayed on the dashboard or reported on that dashboard are absolute absenteeism. However, schools and school boards are monitoring absenteeism due to illness as well. And we do have a process set up with our schools such that they would notify us when they are seeing what they appear to have, an increase in absenteeism due to illness that is at the 30% mark or even higher. And at that point in time, we consult with the school as to what they're seeing and any other trends that are occurring. This would then prompt us to provide the school with a letter that would then be disseminated to the school community, informing them of the situation. In terms of what parents should be doing every day, parents should be undertaking their school screening, monitoring symptoms daily using the provincial screening tool. And really, children should only be coming to school if they do not have any symptoms of COVID-19 and are not a household contact of an individual with COVID-19 symptoms. Beyond that, it's really up to a parent to make a risk assessment and to do what they feel is in the best interest of their child. The health unit will not be dismissing cohorts. We will not be declaring outbreaks, and we will not be calling upon the school to return to online learning. So that is in line with the current guidance.
Thank you. Our next question would be directed to either Dr. Chirico or Shannon. It comes from Sarah Bissonette. What are the discussions with the hospitals around capacity and staffing levels?
I could start, and if you'd like to chime in, Shannon. We are in constant contact with the hospitals and staff level, management level. We attend their emergency operation meetings. So there is a lot of conversations that happen to get an idea of how they're doing, what their capacity is, their admissions, and so yeah, we're both supportive of each other's organizations and help each other out in many different ways. So there is quite a bit of contact, but for details, you'd best be directing that kind of a question to the hospitals if you need numbers. I'll pass that over to Shannon if there's anything she'd like to add.
No, I don't think so, Dr. Chirico. Nothing additional.
Thank you. Our next question is for Dr. Chirico. It comes from Stu from Bay Today. Do you agree with the notion that we're all going to contract the virus eventually?
Yeah, that's a great question. And I know that certainly because what we can say is that Omicron does spread very, very quickly and easily. That is a potential, but we're never really going to know. And it's very difficult to actually do studies to see if that's going to happen. I think it's a question that the science table has grappled with as well. And nobody knows for sure, but what we have observed certainly too is that the severity of the Omicron isn't as bad as what previous variants have been, which is great in that regard. But I think that we always have to be a bit cautious. There's always going to be that potential because of the sheer numbers of still having more people getting ill. And I guess to answer your question, I don't know. I don't think that everybody would eventually get it, but I may be wrong. Nobody knows.
Thank you. So that completes all of our submitted questions for this press conference, and that will conclude our press conference for today. We will be back in 2 weeks on February 17th. Thank you very much.
Thank you.